You may have realized that being healthy feels different than it did in the past now that you're over 50. If you want to maximize your health potential but don't have time to read through overwhelming pages of Google links, this is the show for you. Welcome to Healthy Tips After 50. We love doing the research, finding solutions, talking to health experts, and learning what works and what doesn't. Now, your host. She spent the last 25 years dedicated to feeling her best and is here to share her best findings with you, Susan Rosen.
Hello, everyone. This is your host, Susan Rosen. And today I'm really excited, as I always am anyways, but about my guest, because there's just, he's full of information that is really important to all of us to know. And I'm not sure we can pull it all out in this episode, but you can always come back again for more. And you can let me know if you have any other questions as well. So just to give you a short intro, Dr. Bolad, I don't even know what your first name is. What is your first name?
Islam Bolad.
Islam.
Oh. Islam Bolad, right.
Oh, okay. Okay, great. Well, Dr. Bolad is a triple board certified physician, certified by the American Board of Internal Medicine in Cardiology, Interventional Cardiology, and Internal Medicine. And he has been in this area of medicine for over 20 years and having to do with cardiology as well as the management of cardiovascular disease. And he has over 30 years experienced as a physician. And Dr. Bolad is on a mission to use his knowledge and experience to help the public, bringing them up-to-date information that impacts their health and keeping the public informed about the latest developments in medicine in general and in cardiology in particular. And I will also say that I will include the link to the doctor's website, which is free and open to everyone. And there's even a big button there where you can ask a free question. So if you've got something top of mind, you can go there and get an answer, hopefully, if it's not too complicated.
Happy to help.
With that, welcome, Dr. Bolad.
Susan, thank you for having me, and I'm very excited to be on your podcast.
Oh, thank you. So tell me, I know we chatted very little bit before we got started, and you were saying, which is what I have kind of always figured, that cardiology and cardiovascular issues become more prevalent, let's say, when people hit 50 or around 50. And so maybe you can just give us a little, like a general, idea around that to start.
Sure, yeah. In people who don't have congenital heart disease or hereditary disease, which is the most of the population, as we age, there are changes that occur in our body, including the heart. So heart disease before the age of 50, disease that has not manifest at a very early age for normal individuals, before the age of 50, it's really the prevalence of it is in single digits.
Wow.
Once you hit 50 and you start going up, then the incidence of heart disease, especially coronary artery disease and cardiovascular disease in general, increase substantially. So in the age group up to 60, you will find that the incidence increased to something like 20%. And as we age, it increases more and more and more. So it's all part of the changes that our body undergoes, similar to what you have developed gray hair, etc. There are changes happening internally in our organs, of which the heart is absolutely would be affected in lots of ways because of the stress being put on it. It has been pumping all our life, and therefore with age and degenerative changes does occur, and then it starts to manifest as cardiovascular disease in general.
Interesting. Okay, yeah, because it's not like the muscles in your arms or your legs or something where you can go and exercise that way. I mean, I know you can, a lot of the exercise like running or getting your heart rate up helps.
Right.
The same thing with your heart. But yeah, go ahead.
So, with coronary artery disease is the number one cause of death worldwide. It's the number one cause of death. And yeah, with age, all our arteries, they start to stiffen and deposits of plaque start to build up on it. That can cause narrowing of blood flow to the muscle of the heart, and that manifests in angina or a heart attack when an artery gets blocked and the flow of blood to a segment of the muscle of the heart is affected or compromised. So that's what happens. Now, the buildup happens in all the arteries of the body, but because the heart is continuously pumping, it will manifest much more easier. So we sometimes refer to the general disease of the body as cardiovascular disease, basically involving the heart and all the arteries and the vessels in the body. Why? Because these changes affects the whole arteries in the body in addition to the heart, because it's not really peculiar to the heart. It's all over the body, but because of the heart is always working, it manifests with chest pain, etc. Similarly, if you have, for example, like a stroke, this is still as a cardiovascular disease. Because of stroke, what happens? You get a blockage in the circulation going to part of the brain. So this is still a cardiovascular disease. You can sometimes sub-specify it by saying cerebrovascular disease, but it is still a cardiovascular disease because most of the times the clot comes from the heart, or although it can sometimes be a primary event from the arteries going to the neck or from a clot elsewhere just going straight to the head. Sometimes you get claudications. People who start to get pain in their calves. This is also cardiovascular disease because of the arteries of the legs get affected in the similar way that arteries elsewhere in the body, including the heart, get affected. So the big picture is cardiovascular disease, but in specific cardiac disease or coronary artery disease is very specific to the heart. So I just wanted to put this in so that people understand. Sometimes they hear about cardiovascular disease and about cardiac disease. So I just wanted to clarify this.
Yeah, no, that's very, very valuable because I think so many people, number one, they don't, unless they know somebody or they themselves, right, develop an issue. They really don't, they have no idea. And so they have no frame of reference. In
a large number of people who have a heart attack, usually they don't have symptoms before that. It's just all of a sudden. And what happens is that there is buildup of plaque in the coronary arteries in the inside wall. And as it enlarges, the lining of that plaque just cracks or breaks. When it breaks, it pops. And just like if you have a cut on your skin, you find there is a clot. The same mechanism happens in the heart. A clot forms on that crack. But the arteries are so small, so when a clot forms, it blocks the flow of blood to the muscle of the heart. So a great majority of people who develop an acute heart attack, what called a STEMI, ST elevation myocardial infarction, they don't have symptoms before. Boom, all of a sudden. On the other hand, you will find people who have progressive buildup of plaque. The plaque does not break, but keeps narrowing the artery. And these are the people who get reduced blood flow to the muscle of the heart. And this leads to angina, chest pain that we discussed. When you exert yourself, you get chest pain, or you exert yourself, you get shortness of breath, which is unusual for you. All of a sudden start developing in the last few weeks or so. So symptoms like that, these are important symptoms that you should seek immediate medical advice or immediate medical evaluation before it gets worse. Because as you can imagine, the longer you leave this building up, the worse it's going to get unless you get treatment for it. So chest pain is definitely a very important symptom for us from a heart standpoint. Undue shortness of breath that you developed that was not there before is also a manifestation of that. The pain characteristic is usually dull. It goes to the neck or to the left arm, and it's more we get with exertion. And when you relax, it goes away because you're resting the heart. But there are also other manifestations that we should not ignore. For example, epigastric pain. Some people tell you when we exert ourselves, we get epigastric pain here in the stomach. And when we relax, it goes away. This can also be a manifestation of blockage of the coronary artery. So that needs to be evaluated as well. Absolutely.
Wow.
Sometimes you just feel like heaviness in your chest. Okay. And that's some people really confuse it. They tell you, doctor, I don't have chest pain, but I get heaviness. That's a very important symptom as well. So that should get evaluated. So these are important things that people should be paying attention to. You need to seek advice quickly because heart disease is not forgiving. Sometimes it can happen very acute. You get a heart attack, and then you wish that you have had care before that.
Yeah. Is there any kind of I'm trying to think what the name? I can't think of the word. Hereditary kinds of predispositions, maybe for some of these, right? Because I know for a lot of them there aren't, right? It's just you either get it or you don't. It's not.
That's correct. So if you have got a family history of premature coronary disease, meaning that heart disease occurring at a young age in the 40s or early 50s, consistently in your family, then you are definitely predisposed. So you should be very careful in that. So this is very important. And it's something like you don't have control of, Suzanne. You are born with it. It's just like a lottery for you. You don't have, you're just born, you have got your parents or strong family history of coronary disease. There's nothing you can do. What you can do is just to try to control the other risk factors that predispose to coronary disease and to cardiovascular disease, such as high blood pressure has to be controlled. You should not smoke. You should exercise regularly, etc. Take medications prescribed by your physicians regularly. These help. But if you have got a risk or a family history of coronary disease, this is a very important risk factor. And that's why when our history and physical examination, when we do the first thing, we ask about what's your family history like. If you tell me that all your family or mother or father had coronary disease at a very young age, I will take every symptom you're telling me very seriously. Okay. So it's not like someone who is fit and all right and he doesn't have family history. Completely different patterns here.
So is that something that we should all think about when we go to see our doctors, right? When we do hit a particular age, maybe 50 or 55, if they haven't, usually they've all kind of gone through and check, right? Is that something that should be discussed anyways and brought up again to remind people? Because a lot of times, I mean, I know myself, they'll ask and you'll go, oh, no, nobody in the family like that. And then you get home and you go, well, gee, actually, Uncle George might have had a heart attack now that I'm thinking about it, right?
So usually in the form that you get before you see your doctor, usually there's a form that tells you it's almost always there, ask you about family history.
Right.
Some people might take this lightly, might just take it. But if you have that, you should really point it out for sure. And even if you don't have it or if you forgot about it, you should tell your doctor during the consultation so that he pays more attention to the symptoms that you are describing. So he can have a better awareness of what he's dealing with regarding your symptoms. So family history is very important for heart disease and for other diseases. For example, if you have got a strong family history of diabetes, then you ought to point it out because you are still predisposed to that disease. Or strong family history of high blood pressure. That's also usually, and we should have to keep a very close eye on your blood pressure. So family history is very important,
Mm-hmm.
and it's not something to be missed or to be taken lightly.
Mm-hmm. Mm-hmm. Okay. Assuming you know your family history.
Assuming, absolutely, yeah, obviously, I mean that's what
Yeah.
sometimes you don't know your family history.
No, exactly. But I'm just saying, I think some people, other than your own parents or maybe a close aunt or uncle or something,
Yeah,
it's up for grabs.
absolutely. So yeah, if you know your family history
Mm-hmm.
and you know there is a problem, you really ought to point it out early in the consultation.
Yeah.
And Susan, it's just one thing I say regularly to all people, and it's particularly important for people 50 and above.
Mm-hmm.
I tell my patients, and this is a very common example I use all the time because I feel that it relates to lots of people. I tell them, look at your health and your heart health as if it is your car. Yeah. If you maintain your car well, you look after it, you change the oil, you go to take it to service every few months, etc. That car is going to last you for a long time. Whereas if you don't do these things, that car probably will not be running for a long time. Yeah. And I tell them, think about your body exactly like that car, and the heart are just like the engine of the car. You need to have regular checkups there, and you have to maintain your body well by not smoking, exercise regularly, healthy diet, control of blood pressure, etc. That will make sure that you live a healthy life to your full potential, rather than being not able to do lots of the things that you would love to do at a very early age, because 50s is not really old at all, or 60s is not old at all in the current day and age, especially. It's not anymore because of the medical advances. So if you take good care of your body and of your heart, you should live much longer, a healthy life, not being sedentary or not being able to do the things that you would love to do. Right. So this is just an example that I tell my patients all the time. Just treat your body as if you're treating your car.
Yeah. It's a good point. I think somewhere I had read as well that women in particular, as they're going through menopause and that whole time of life, quote unquote, also makes us a little more, I was going to say predetermined, but that's not the right word. Predisposed, thank you. Yeah. For developing various cardiovascular issues. Is that true?
Well,
sort of, kind of?
It's sort of, kind of, yeah, absolutely true. Yeah. And that is, the menopause itself is not a cause of heart disease. But when you get into menopause, then you lose the protective effects of the other hormones that protect you.
Got it.
So you get this unshielding or removal of this protective effect. So it's not the menopause itself. It's really that now you are not as protected as you used to be, and therefore you have to be more careful. So this is true in that sense. So once you get to that age group, women are usually less likely to get coronary disease than men. But once you lose that protective effect of the hormone, then your risk starts to go up to be as close as possible to that of men, although it's still less than men, but it still to go up. So you see most of the people who get heart attacks, if you just think about it in ads and in general life, they are mostly men, right? Yeah. But once you hit the 50 and above, then your risks start to increase. And that's when you have to be super careful and to take great care of yourself. You should have been taking care of yourself before that, because you don't want to be things have been building up and you're being protected, and now the protection is gone and boom, shows. So that is the issue about it.
Okay. And whenever you go to the doctor, the thing, at least where I go to my doctor, we won't shall be nameless. They're always looking at, okay, so I go take a blood test, and all they ever look at is my cholesterol. And I go, well, aren't you going to check for anything else? Oh, no, we only check for cholesterol. It's like, there's got to be more.
Yeah, no. when you go for a check, you especially if you go for a yearly check, you should have almost everything checked. I do that for myself every year. I check all my blood tests, cholesterol, vitamin D, calcium. It's everything.
Right.
Everything is checked. Yeah. So a full thorough examination should check lots of things. You might add this other things. For example, if you complain to me of tiredness and feeling cold, I might also check your thyroid, for example. Okay.
So
thyroid. Exactly. So there are other things that you check, but that is targeted towards your symptoms. But in general, you should have your kidney function, liver function, complete blood count, cholesterol as part of it. All this should be checked routinely. You should have, if you have got any family history of coronary artery disease or history of shortness of breath, or you should have an EKG as well, etc. So a checkup is a checkup, just like you take your car for service, it gets checked up. They don't just look at one part and just the whole car has to be checked, and so you have to be checked as well during that visit. Yeah,
that's what I've always kind of thought. So yeah, because I have my cholesterol always comes with both of them being really high. So then they say, well, it's not an issue because you've got the good cholesterol is even higher than the bad cholesterol. It's like, okay, fine, bye.
So the cholesterol issue is really interesting, Susan. When I was medical trainee, or even the first few years of my training, we did not used to treat cholesterol. I remember it very clearly. People come with very high cholesterol, and the thought at that time, or at least the data at that time was shown that when you take cholesterol medication, you are predisposed to other risk factors, etc.
Yeah, it's even worse.
Absolutely. And then these new medications called the statins came into the market, and simvastatin was the first one of it. And then this big study called the 4S study came, and that was the first study that showed clearly that taking cholesterol medications really helps and saves lives. From there, it just took off. And I remember it was in the mid-90s or early 90s, mid-90s, say. That's when this study came, and then from there, it just took off. Cholesterol treatment started and accelerated, etc., etc.
Yeah.
Now, I rarely see any of my patients who are not on cholesterol medications. This is just a fact. I rarely see anyone that's not on cholesterol medication. So I personally take cholesterol medication at night, not because I have got high cholesterol. Actually, I do have slightly high cholesterol, but I don't have any symptoms. I'm fairly fit, but I take it. Why? Because I believe in the data that I read, and I know that the data is quite good. So I take cholesterol medication just to lower my risk of future events. It doesn't harm me. Now, if you look at any medication, you're going to find side effects, from liver disease to etc. to disease. You're fine. If you look at the whole list, you will never take a medication.
Ever.
Because there is a long list on any. Look at any brochure of any medication, you find a long list, but these are very uncommon ones. So cholesterol, if it's elevated, it should be treated. Especially if it's elevated, it should be treated. The current medications are quite good and are quite safe, and it should be treated irrespective whether you have symptoms or not. That's my personal belief, because it protects you. And as I said, I take cholesterol medication. I don't have any symptoms at all, cardiac symptoms, but I know it protects me, and therefore I take it.
Interesting. Okay, well, I'll have to take a look next time they tell me I should do that. They, like I say, they don't argue with me, mostly because the good cholesterol, like I say, is higher than the others. So
so lots of the people, some doctors go by the symptoms. If you don't have symptoms and it's just like a normal check, okay, just fine. But now there isn't much data on people above certain ages, but I believe that if you can take it, you should take it. And all our advice and knowledge comes from trials, and certain trials haven't included certain people at certain age groups, and therefore because of that you cannot have, say, it's FDA approved or it is in the guidelines, etc. Because these trials haven't included certain people for sometimes because these trials cost a lot of money as well. And you sometimes, when you're doing a trial, you try to may put it in a population that you're most likely to get positive outcomes, and it's going to impact your bottom line of revenue at the end of the day.
Yeah.
So not every patient has been studied or every age group has been studied, but the data shows that cholesterol medications are really helpful on the long term.
Okay. So they have done quite a few on older people though, right?
So in the guidelines, I mean, there isn't much data for people above 75. So that's a group that you see people sometimes taking it, some people don't take it, and the doctors sometimes don't prescribe it if they're not on it, because there isn't really solid evidence. Put it that way.
Yeah. Right. Okay.
There isn't literature you can say, well, go and look at that trial. That's what it showed. Yeah. But if you're asking me personally, and for my parents, for example, they take both of them. They take cholesterol medications.
Interesting. Okay.
Yeah. Okay. Because that's I know that's going to help them, and that's what they're doing.
Okay. Interesting. Yeah, because I mean, I'm not 75, but I'm 67. So kind of the.
No. I mean, you're certainly, if you have got. I'm not obviously a doctor. I'm just giving advice.
No. I understand you're not prescribing. I got that.
I'm not prescribing, right? But it's something really. The importance of these discussions is that non-medical people, not people in the field, get empowered by the knowledge.
Yes.
So now that you have discussed it with me, etc., then next time you're going to see your physician, I'm sure they're going to bring it up.
Oh yeah, no, I have no doubt that they will. And this
is one thing behind my website is that I'm here to empower you. If you look at my website, drbolad.org,
all right.
I got any question you want to ask me. I'm here to empower you. Absolutely,
the big button is down there right on the bottom.
Absolutely, any question you want, and I really answer all the questions. I get every day I get tens of questions, and I answer all of them.
That's great. Yeah. No, it's wonderful that you're getting people reaching out to you to find out. That's great.
I've got people from all over the world. From States, from Europe, from Asia, literally from all over. They ask questions, and I do answer all of them.
Wow. Okay. Well, I'll have to remember that.
Yeah, absolutely. Any question, anytime.
Because I do come up with questions quite often.
Anytime.
Okay, that's good. So that'll save me all that time on Google, right?
Absolutely. Absolutely.
Oh, yeah. So let's talk a little bit about high blood pressure, because that's a big deal, right?
It's a big deal, especially as we age, as we pass 50. Then high blood pressure is probably the commonest issues that you will get.
Okay.
At that age group, there is high blood pressure. As we age, as we discussed earlier, our arteries become stiff. Deposits of cholesterol occur on them, and with the stiffness, and the arteries become less compliant, then the blood pressure starts to go up, and so high blood pressure increases the risk of further damage to the arteries, because the arteries are already suffering, and you get high blood pressure, so that take an effect on the lining of the endothelium, in the inner lining of the coronary arteries.
Okay.
That also predisposes you to injuries such as, for example, strokes. Yeah, you put a pressure on the heart, and by putting a pressure on the heart with high blood pressure, you can get heart failure because of that. So it's a big deal, Susan, high blood pressure. So you should be checking your blood pressure regularly. Everyone should be checking their blood pressure regularly. In that age group, above 50, I think that once or twice a year is not enough. You should at least do it like once a month or twice a month. You just should become part of your, because we are predisposed at that age group, all of us. And I certainly get it checked fairly regularly by virtue of my job. Whenever every now and then, measure my blood pressure. But that's important, because unchecked blood pressure can have very serious consequences. From the heart, give you heart failure. It predisposes your risk for heart attacks as well.
Oh.
Yeah, it predisposes risk to damage to all the arteries in the bodies, including the legs, the brain. You can get a stroke. You can get hemorrhagic stroke just by increasing the pressure. High blood pressure, the other name for it is the silent killer. The silent killer, because it is really the silent killer. You don't get symptoms until it's too late. You can go for years unchecked, it damaging all the organs of your body, all the arteries in your body, without you knowing until it's too late. And at that time, it's not easy to reverse the damage, or it's not really possible to reverse the damage. I've got a video on my selection of videos on my website. One of them is high blood pressure. It's really worth seeing. It gives you all the levels and what high blood pressure can cause on the lot. But high blood pressure is the commonest disease, cardiovascular disease you find people over 50. High blood pressure, because of the changes that happen in our bodies over time. So this is the big one, as you said, and it ought to be treated. Some people say, "Oh, I'm feeling fine. I don't need to take medications," and that's really why it's called the silent killer. You know, you don't feel anything. You feel okay. Okay.
Until you're dead. Yeah.
Until something serious happens, right?
Yeah.
So you should treat your blood pressure if it's high, irrespective. Take low sodium, more exercise can drop your blood pressure. If that does not bring your blood pressure down, then medications ought to be taken to bring your blood pressure down. So all these things ought to be done. So high blood pressure has to be taken very seriously. And I keep telling my patients to make them aware of the gravity of high blood pressure. It is a silent killer. So
So can we use those little things where you just stick your finger in, that we all got during COVID to check your oxygen? Does that check?
That's mainly for the pulse and for the oxygen
Okay, it doesn't do the pressure.
I mean, there are different. There are now the wrist ones, but the best one is really the cuff ones. And you should measure your blood pressure in both arms to make sure there is no difference. Because sometimes as we age, we develop blockages in the arteries that leads to the arms and the legs. So if there is blockage in one artery, you will get a false low reading. So you should really check them in both arms to make sure that there is no difference in between the two arms. So, I mean, now blood pressures are widely available in any store. In CVS, Walgreens, or even in your grocery store, there is always sections there to buy blood pressure machines.
Okay. No, that's good information. What about low blood pressure?
Right. I mean, some people develop low blood pressure secondary to diseases. The commonest is actually secondary to medications that you take to treat to treat high blood pressure or to treat heart disease. As a side effect, you get low blood pressure. So low blood pressure obviously is significant in the sense that it's not going to damage your body, but it's going to make you feel very unwell and very tired and not being able to function properly. You get dizzy and weak. So that is the problem with low blood pressure. And sometimes it's difficult to bring it up because you need the medications to treat certain things in your body or for your heart. And then as a side effect, you are getting this low blood pressure. So low blood pressure on itself does not damage the organs, but its side effects are quite significant. If you get too much low blood pressure and you get too dizzy, you might fall and hurt yourself badly or bang your head, and that can be very serious, obviously. So that is the significance. You see, that's the significance of low blood pressure. So this is a commonest cause for it. Now, there are certain diseases that tend to cause a low blood pressure from the nervous system or metabolic diseases, etc. But these are uncommon. The great majority is medication induced.
Okay. Well, I don't take any medications. And my blood pressure is like 120 over something or other. Yeah.
Oh, Susan, this is not low. This is normal.
Oh, that's normal? Oh, good.
Yeah,
okay.
yeah.
Is it just because everybody else is so high?
Yeah. Well, you are blessed. This is not low. This is normal. And that's where it should be.
Okay, good. Yeah, sometimes it's a little bit lower than that, but most of the time, I think the lowest it's gotten is when I've gone in has been about 117 or something.
No, this
I'll
is
tell
very
you.
good blood pressure, and
Oh,
you're
right.
blessed
Oh,
for sure.
thank you.
Yeah.
Good. That makes me feel a lot better because they'll always comment, "Oh, you have such low blood pressure. How
No,
wonderful
this is
for
not
you."
low. This
So,
is normal.
yeah.
This is a desired blood pressure. Yeah,
Good. Good. Okay, so
absolutely.
I'll stay with not taking any medications.
That's great. Yeah, that's great. If you don't need them, don't take them. Yeah, but this
Yeah.
is normal blood pressure.
Oh, good. That makes me feel a lot better. Truly. Truly.
Yeah, absolutely. Yeah.
Yeah.
I mean, yeah. So, I get these questions actually, very similar questions to the one that you just asked from my website. And
I bet.
lots of the time it's high blood pressure, but sometimes I get low blood pressure, like someone
Uh-huh.
saying, "Oh, it's 120 or
Uh-huh.
115." I said, "This
Yeah.
is very good. You really don't need to do anything. You are doing well." Yeah,
Yeah. Yeah, exactly. Exactly.
absolutely.
Just my cholesterol, right?
Yeah,
That's the
yeah.
problem.
The cholesterol we need to be checked and treated. Yeah,
Yeah, what can I say? Yeah, we
it's
won't
okay.
go there. Um, so are there other warning signs that people should watch out for? You know,
So for coronary disease and for heart disease, chest pain is the number one symptom.
okay,
Undue shortness of breath is the other one.
okay.
Um, these are the two big ones. But also things like if you get a swelling in your stomach, having swelling in your legs, or at night when you lie flat in bed, you start to get short of breath. These are other warning signs, meaning that the heart is not functioning as much as it should do. If you get episodes of momentarily dizziness, and it goes back to normal, that means that you might have irregularity of your heartbeat. If you feel obviously your heart is thumping, etc., extra beats, that needs to be investigated. So there is actually a whole lot of symptoms you can look for, but the big ones are the ones I mentioned. I've also got a video on my website. It says symptoms of heart disease, and I talk about all the symptoms that people should be looking for regarding their heart. So these are the commonest ones: chest pain, shortness of breath, swelling.
Is there something about in your arm or something if you
So angina or angina meaning pain from the heart. Lots of the time it radiates to your left arm, to the left, not the right.
Yeah.
So pain, which on exertion of pain, radiates to the neck, that's one side, or radiates to the left arm, has to be taken very seriously. This is very likely a manifestation of blockage of the coronary arteries that needs to be attended to. So that's what the arm relationship is to the symptom of heart disease.
Interesting. Okay. Yeah, because I know, like in the movies or whatever, people are always grabbing their arm and
the left arm.
The left arm.
Yeah, and very rarely it's the right arm, but it's most common the left. It's most common the left arm. Yes.
Okay. Interesting. Yeah. So how of a chance, I guess, is it for people who don't have a lot of heart-related, stroke or heart-related types of things to have to end up having something like that? If they don't, if your parents have never had it, or if your grandparents never had it, or, is it just that it makes it that much more and everybody's got a certain level of chance as they get older, period?
They are absolutely right. Everyone has got a chance, especially as they get older.
Okay.
Our bodies undergo changes as we grow. I gave the example earlier of gray hair, etc. But these changes are happening all over our body in all the arteries. So you have to be very careful. You don't say that I don't have a symptom, therefore I can indulge in bad diet or don't care about my blood pressure, etc. These are you have to be careful as we grow older. The incidence and the risk of heart disease and cardiovascular disease in general increase substantially. I keep telling my my residents and fellows in training, I have got like a magic number, magic age, which is just basically for my population of patients that I deal with, not because of anything, not based on any science. I tell them, if you get stuck, when I ask you the name of a patient, the age of the patient, you get stuck, you can tell me 72. And 72 is usually the magic number for me, for my patients. Believe it or not, lots of them are in that age group. So as we grow older, Susan, most of
Yeah.
us start at late 60s, early 70s.
Uh-huh.
They have substantial increased risk of having cardiovascular disease. So
Okay.
you have, the more we age, the more careful and strict we have to be with our risk factors and trying to control them.
Okay.
Irrespective of
Okay.
whether you have got a family history or not. The family history, when it manifests early, we label it as premature coronary disease or premature heart disease. Premature meaning not happening at the time that they're expected to be, and that is
Okay.
in older age group. But if you have been healthy and you're that age group, then you have to be just super careful.
Yeah. Yeah. Interesting. Okay. Yeah. Does do you have, I mean, if you eat a good diet and exercise and all that kind of stuff, and your parents lived, late,
A long
like
time.
old,
Mm-hmm.
does that give you a better chance?
It does, obviously. Yeah.
Yeah.
It does
Okay.
mean that at least you're ruling out the risk of, you're ruling out the development of genetics in you developing the disease.
Mm-hmm.
But nonetheless, it's not by any means a guarantee. As we said,
Yeah.
and I
Yeah.
go again, I give the example of
Right.
of the car. If
Yeah.
the car has been running for 80 years, that engine has been working for a long time. You need
Yeah.
to take very good care of that engine
Yeah.
in order to keep it running.
Yeah. Yeah.
So irrespective of whether it gave you problems before or not. So
Yeah. Okay.
as we yes, if you have got good genetics,
Yeah.
and you are blessed by having longevity in your immediate parents or grandparents,
Yeah.
yes, you are likely have got the good genes,
Yeah.
but by no means it's
It's
a guarantee.
right. It's not a get out of jail free card.
Exactly. Yeah, exactly. Yeah, exactly.
Yeah. No, exactly. Yeah. Interesting. Okay. Yeah. No, I was just thinking about my mother. My mother was in like 94
Oh wow.
when
Well,
she
you have
finally
you
went.
have got the good genes, Suzanne.
Yeah. No. My father was in his late 80s, I think, and he had a heart attack when he was in his mid 60s, I think, early 60s. It wasn't a real bad one. But yeah, and he came from a family of 10, so, and there were very few, except for one who was sick from the time she was like 15 or something, so it doesn't count.
No, this is definitely a good family history.
Yeah.
For sure, yeah.
Yeah. I
Because
think so.
Yeah, no, it is true. It is true because this disease, especially cardiovascular disease, runs in the families, and if you have got a good family history, then that's great news.
Mm-hmm. Yeah.
Because
No,
I get also the other end of the spectrum. I get patients who get heart disease very early, and they just can't believe it, and they tell you, doctor, I exercise regularly so many times a week. I eat very healthy. I don't smoke. Why did I get the heart attack? So the very likely thing is that you have got some bad genes or family history running, because you are doing all the right things that nobody really would do, and still you are getting the disease. So this is the other end of the spectrum, Susan, that I see.
Yeah. No, that makes
People
sense.
just don't believe it why they had a heart attack or got significant coronary disease, in spite they're doing all the right things.
Yeah. So what if you weren't doing all the right things when you were young?
So
because I smoked for a long time.
Right. So stopping smoking obviously halts the progress of smoke-related disease. So, and it's a good sign, because the more time passes from you stopping smoking, the more your arteries stabilize and they're not as predisposed.
No, I quit when I was 30. So.
Oh, that's a long time.
I started early.
Yeah. Obviously they're damaged for a very little amount of time, for a few years, and then after that
probably
you stop.
10 or more. Yeah.
10 or more. Yeah. So I think after you have passed a few decades far past that, then that risk
which
is,
I have.
Which is very little. Is very little indeed. Yeah.
Yeah, no, exactly. Yeah, well, what can I say? When you're young and foolish, stupid.
Yeah, all of us have passed through these stages that you think that disease only affects other people, it doesn't affect you, but this is
Yeah,
not.
right. Well, that too, yeah.
Yeah, so
Exactly. But, otherwise people would never have kids, right?
absolutely
If they
true.
really understood.
Yeah, this is true. That's
So,
absolutely true. Yeah.
yes. Okay. Well, is there any final word you want to say? And then we'll kind of wrap it up here.
Well, I would just would like to say to people that your heart is very precious. We all get one shot in life, especially dealing with your heart. It's basically the engine of your body. It's very important to maintain it well and to take great care of it. If you do, in the great majority of cases, it will serve you well for a long period of time. Avoid things like, obviously, the risk factors like smoking or high blood pressure, cholesterol,
alcohol.
One issue which is very important in the population is obesity, especially occurring after the age of 50. Obesity is a predisposing factor to high blood pressure and coronary disease, etc.
Which makes sense.
So also try to maintain a normal body weight and a normal body mass index. These are the important things really that you should concentrate on in order to help your heart serve you for a long period of time with less trouble. This is what I would say to people, and I always just for people who are listening to this podcast, I would say think about it as your car and the engine of your car, and see what you would do for that to keep it running. If any one of your audience, Susan, at any time has got a question, my website is drbolad.org, the full word doctor, DOCTOR, Bolad, BOLAD.org. As you said, there is a big blue button there, ask a free question, press it and send me a message, and I do reply to all my questions. So that really helps a lot of people. And the reason and the purpose of that is to give people the knowledge empowerment, so that when they go and see their doctors, they are more informed about what they need to ask.
Yes, and tell them.
And tell them.
Tell them anything that's, don't go in there and forget to tell them that your arm hurts, or that, you haven't been breathing easily, or whatever it happens to be.
Yeah, exactly. Or a family history, etc. Yeah. I have also got lots of educational videos on my YouTube channel, and people can just go and look at it. And I always try to be current and give up-to-date information about new things. I get lots of my ideas actually from my questions that people ask me.
I bet.
So when they ask me, when I get a question, get it repeated regularly, then, that's a good video idea. I'm going to talk about that. And that's another resource. Most of we spoke about high blood pressure. You'll find the high blood pressure topic there. We spoke about symptoms of heart disease. You'll find a video about symptoms of heart disease there. But at any time, please feel free, anyone who's listening to this, to ask me a heart-related question anytime.
No, that's great. I'm sure they'll appreciate that.
Anytime.
For sure. So,
anytime.
And like I say, I'll put the link to your website in the show notes when it goes up.
Okay.
So
great. Yeah.
That'd be great.
Yeah. Thank you.
Well, thank you so much for coming on. I really appreciate you taking the time to be
thank
on
you,
the podcast.
It has been a pleasure, and it has been very nice discussing the issue of cardiovascular disease with you. Thank you.
Well, thank you. And I will say, which I usually do in closing here, which is it's always kind of funny when I say it in this situation, but that this is not to be conceived as medical advice. And if you are having an emergency, please go to a hospital, go see your doctor, whatever is appropriate, and get it taken care of.
Absolutely.
Yes. And with that, I will tell everyone that I will see them next week.
This has been Healthy Tips After 50 with Susan Rosen. To stay on the cutting edge of the most effective health strategies, subscribe to this podcast and let us know what you thought of the show with a comment or like on iTunes. Visit healthytipsafter50.com for this episode's show notes, more resources, and free offers.